I'm Bev, this is Andy, and today we're going to answer one of your questions. Brian, thanks for sending me an email. Brian wants to know what he should do to counteract the fact that he sits in a chair all day. It's very common these days to sit in a chair and be typing away at the computer. So I'm going to use this as an opportunity to review anatomy. I bet you aren't surprised. I want to go over the hip flexors and more specifically the psoas group, because in a lot of anatomy courses the psoas muscles are taught as a whole as one muscle, but there are actually 3 that it breaks down to, and you have like 8 or 10 hip flexors. We're not going to go over all of them today, but I will go over the 3 psoas muscles, which you're going to see it's actually quite interesting that they group them together because they're very different. The 3 muscles are the psoas major, psoas minor, and iliacus. The psoas major attaches to the lumbar bodies on the front of your vertebrae. It generally attaches to thoracic or T12, lumbar L1, L2, L3, L4, and L5. And it comes down to the lesser trochanter, which is a little bump on the back side of the femur on the posterior medial side, which would be back middle. So if I face the femur forward and then turn it slightly into external rotation, there's this little bump right here, and it's right below the socket of the hip. The psoas minor, which a lot of times is grouped with the psoas major, is quite different. It does share attachments on T12 and L1. Depending on what anatomy book you look at, this may vary, and of course that just comes from the cadaver dissections that are done. Sometimes they're different on different people. And the psoas minor comes down just to the pubic bone, and it doesn't actually cross the hip at all, so it's not even a hip flexor. It is a muscle that helps to do a posterior pelvic tilt, which is tilting your pelvis back and slouching, so to speak. So we have psoas major and psoas minor attaching to the anterior spine. Psoas major comes down to the lesser trochanter, psoas minor comes down to the pubic bone, and then iliacus, just like its name, is on the ilium in the iliac fossa right here. And it's a big muscle, it covers the whole hip, it comes down, this balloon represents it, and it wraps around to that lesser trochanter. And I have the balloon here because it's stretchy like a muscle. Well, it can contract like a muscle to show you that when you sit, this muscle gets shortened, psoas major gets shortened, and psoas minor is going to depend on your pelvic position. So when you're sitting at a desk all day, these muscles are in a shortened position. And the psoas minor is going to be shortened only if you're in a posterior pelvic tilt. When a muscle is shortened for long periods of time, it will get tight and then it needs to be stretched. The best way to stretch it is to do an active stretch where you're actually using the opposing or antagonist muscles to stretch it. And let me show you a couple exercises to employ that philosophy. So let's pretend this is our psoas major. So if it's attaching to our lumbar vertebrae and comes down to the lesser trochanter, if we rotate our trunk, I can feel this balloon stretching. And if you have a rubber band at home, you can try this. I can feel that it's stretching, so that's great. So I could just do some simple trunk rotations in my chair to stretch it if I don't want to get out of my chair. Also, if I bend my spine to the side slightly, it stretches a little bit. So you can figure out some exercises on your own just by using a rubber band or balloon at home. The iliacus as well will stretch slightly when you rotate. Now, of course, the best thing is to get up out of your chair every 20 or 30 minutes, walk around, do some squats or marching in place or hip extension movements, and that's going to be the best thing to do. But if you can't get out of your chair, another thing you can try is sitting, and let's actually go over the pelvic tilt. Put your hands around your hips like they're a bucket rim, so like as if you have a bucket here, just like the pelvis. If it continued, it would be a bucket. And you're going to tilt your pelvis back, that's posterior pelvic tilt, and then tilt it forward, that's anterior pelvic tilt. And in general, you want to be in neutral, where the bucket is sitting nice and stable. And if you're sitting in that neutral position, the iliacus is helping to, or not the iliacus, the psoas minor is helping to stabilize that. So even just doing some pelvic tilts in your chair at your desk is going to help to get the blood flow to these muscles and loosen them up. But when you go to the gym, Brian, what you should do is work on hip extension movements, which means working the other side of the joint. Hip extension would be working your glutes, working your hamstrings, and getting the other muscles working that are not getting used when you're sitting at a desk. In fact, those muscles attach on the posterior side of your body, your glutes and hamstrings, and they get stretched while you're sitting in a chair. So they're gonna really appreciate contracting when you're done sitting at your desk. I hope this was able to help you out. If you liked this video, please go down and like it and leave a comment if you have any other suggestions for Brian or people in our community. I'd love to hear from you. And if you think somebody else could benefit from this video, please pass it along. Share the love. Hey there, you've been asking, so we created an online anatomy program just for you. Visit the web link below, go enter your email on our website, and you'll get some free training videos as well as an offer to get a special discount. We'll see you over there.